Hey, you are watching AliAziz YouTube channel.
Top 15 Behavioral Nursing Interview Questions and Answers. AliAziz Quality Education YouTube channel provided you the medical related topics videos. So don't forget the subscription button. 1. Describe a time when you did not communicate well, either in writing or verbally. What was the outcome and how did you handle it? When I first became a nurse, I was nervous and probably too chatty and talked way too fast. I remember one patient just looking at me and nodding her head. She was an elderly woman and a little confused at times, and she was saying she didn't like the pink pill. I smiled and chatted over her and just really didn't stop to hear her, and she always took the pink pill, so I didn't think anything about it. I was encouraging her to take her pills when her daughter spoke up and said, "I think the doctor discontinued the Prozac, which was the pink pill, today." My patient was trying to tell me something about her pill, and because I didn't listen closely, I almost made a medication error. I didn't make the error, but I still reported the incident to my nursing supervisor as a near miss. The doctor had just left the room and had not entered the order yet, but I still should have listened to my patient. I apologized to her and her daughter, but I learned an important lesson that day, and that is to talk less and listen more to my patients. 2. You are very busy and a bit overwhelmed with your daily tasks, but it is time for your morning team huddle. What do you do? I would make sure all my patients were properly cared for and then attend the team huddle. It is my understanding that huddle meetings are very short and are important for team updates, so I would make it a priority to attend. And, if I were so overwhelmed that I felt I was at capacity, a huddle meeting is where I could express my concerns and let it be known that I may need help. I know that nursing can be overwhelming at times, but it is important to remember that we are all part of a team and attending daily huddle meetings is very important. 3. You are a floor nurse in your unit and have close relationships with several of your colleagues. When your supervisor goes on vacation, she appoints you to be in charge. How do you approach supervising the nursing staff in your unit? If I was serving as acting supervisor, I would set any and all relationships I had with my peers aside and treat everyone the same. I have been in this situation before, where I have stood in for my manager while she was on vacation, and I found that the only way to be successful and fair was to compartmentalize everything while in charge. It can be a difficult situation to be in, as sometimes your work friends want you to make special concessions for them, but in order to be fair, you can't do that. So, in this situation, I would make it clear that I am not their friend, I am their supervisor, and I am going to follow the rules as stated in the handbook, for everyone. 4. Describe a time you effectively instructed a patient on something they were struggling with learning. During my home health rotation, I worked with a patient who said her medications weren't working, but they worked when she was in the hospital and in the rehab center for several weeks after discharge. I asked her to bring all of her medications out to the table, and they were tossed in a cardboard box with old and expired medications with no sense of order. She told me she took them faithfully every day and never missed one. I looked at the bottles and noticed that they were all ordered on the same day of discharge, but several bottles were full and others were almost empty. I asked her if I could help her organize her medications, call the pharmacy to help with automatic refills, and also get her a medication minder. We filled the 2-week minder together and that really helped her take the correct pills. The next visit, she happily reported that her meds were working again. 5. Describe a time you effectively handled a hostile patient or family situation. What was the outcome? I was working on a medical surgical floor and a patient had gone to surgery. The patient's family member was waiting in the room. The surgery took longer than expected and crossed shift change. The morning shift left and I was not aware that the patient's family did not know of any updates. I was preparing my medications when I could hear the family member's elevated voice from the room. She was on the phone talking in a panicked voice telling someone that something was terribly wrong. I knocked on the door and asked if I could help her. She asked where her nurse was, and I told her that I was the new nurse. She was terribly upset that the other nurse did not give her an update. I told her that I would call the recovery room for an update and did so, and was instructed that the patient was in recovery and would be there a while. I told the family member, who was visibly relieved. I also ordered a tray from the cafeteria for the family member and took it to her, as she had been worried and waiting all day and she was grateful. 6. What is the best way to handle a patient who is refusing their medications? I worked with a patient who had just started on an SSRI a couple days prior, and she stated she didn't want to take it because it didn't work, and it was making her nauseated. Being that I understand that it takes at least 4 weeks for this type of medication to work, and sometimes patients experience temporary side effects before the desired effect, I was able to explain that to her in a way she could understand, and she was much more willing to comply. 7. Your patient's family brought too many boxes of candy, and the patient wants you to take the unopened one. How do you handle this scenario? I would politely decline any offers of gifts, no matter how small, as I feel that nurses should have solid, ethical standards. Patients are vulnerable and in our care, and to take something from them could be seen as taking advantage of them. They could be medicated, stressed, or afraid. I think it's best to have a policy that nurses do not accept gifts from patients. I would be sure to thank them for the offer and explain the reason why I could not accept, but further express how grateful I was for their appreciation of my service and work. 8. How do you prioritize tasks when things on the unit get unexpectedly fast moving? I know that as I enter a nursing career, I will be asked to do some pretty extreme physical activity. Lifting patients and standing for long hours at a time comes easy to me as I've participated in sports all the way through high school and continued this through college. Being in great shape and eating healthy is a lifestyle choice that I have made, and it will definitely help me in my nursing career moving forward. 9. Tell me about an experience when you had to use ACLS, BLS, or PALS protocols in your nursing practice. Part of my nursing training was to become certified in both ACLS and BLS, and I am interested in becoming certified in PALS as well. However, I have not yet encountered a patient situation where I have had to utilize these life-saving skills. While I have never had experience utilizing these skills, with the training that I received, I am very confident that I will be able to properly execute the protocols. I take my responsibility as a nurse very seriously, and when it is time for me to provide life support measures, I will be ready to do so with confidence and skill. 10. Talk about a time you had to communicate a complicated medical issue to a patient or their family. How did you go about relaying the message? During my clinical rotations as a pediatric nurse, we had a young girl come in with severe pain in her ear and head. After my initial check on her, I noticed she had some severe congestion in her ear and nasal cavities likely causing the pain. Prior to the doctor coming in and noticing she was very nervous, I used the metaphor that her ears and nose were like a cave and bad monsters had gotten into the cave. I explained to her that the doctor needed to look at the monsters to be able to give her the right medicine to get rid of the monsters in the cave and clear the way again. With that said, she was in a giggling mood and sat nicely for the doctor to fully check her out. 11. How much supervision do you want or need in your role as a new nurse in a new position? I think it depends on the length of orientation I receive for the position. I am confident that I bring a level of competency to the position with my past experience, but every unit is different. I can be a self-starter with minimal supervision with regular cardiac catheter patients but would like access to supervision with more complicated patients. And I always appreciate supervision and critique from nursing leadership to learn and be better. 12. How many patients is a full workload for you? During my career as a nurse, I have found out that the number of patients that I'm comfortable handling is relative to the unit that I'm working on. In a highly acute ICU, I've worked with as high as 8 patients on a shift and felt this was overwhelming. On a med-forward/surg unit, 8 patients on a unit that I'm responsible for is low. No matter the unit that I work on, I have a great method in place for prioritizing the needs of my patients and make sure that all of my patients' needs are met in a timely manner. 13. Tell me about your 4 skills. Are you able to start on 4? I am very comfortable starting and managing force, and, in fact, I start force on a daily basis at my job and I have for many years. Since I have spent the past decade working as an inpatient floor nurse, it has been my responsibility to ensure to properly manage my patients' force and move or reinsert them if needed. In my unit, I have a reputation for being able to start force even in the most difficult veins or the most difficult locations, and I am often called to help my colleagues start difficult force when they are running into trouble. 14. Tell me about your experience and abilities in collecting lab samples, such as blood, tissue, and other specimens. Elaborate on the entire end-to-end process of collection. Since I work at a family medicine practice, I have experience collecting many types of lab samples, including blood, urine, fecal, skin, and other types of samples. Anytime I collect a sample from a patient, I always confirm their name and date of birth to ensure I am matching the sample back to the appropriate patient. Then after the sample is collected, I document it in our laboratory log, so there is a record of it going out to the lab. It is just important that the lab sample is documented appropriately, so we can track and monitor the sample, and ensure the patient gets the results. 15. What precautions do you take with a patient in poor health? During my schooling as a nurse, we were required to take a communications class. Here, I learned excellent question and answer techniques to get to know a patient's health history better. As I enter the workforce as a new nurse, I know that I will be able to put these skills to use with each and every new patient that I encounter to help me give them the best care possible.